This was a study using, maybe taking a step back, so there are two broad ways that we're able to detect these very low levels of circulating tumor DNA. One of them is tumor-informed, which was what the LEADER study was based on, an assay where we sequenced the primary tumor and designed an assay to look for mutations that were specific to the tumor, so we knew what we were looking for. That's great. The one limitation is that you do require tissue. And so another application on how we're able to detect very low levels is using more epigenomic signatures, so not looking for mutations in the DNA, but rather modifications of the DNA, which doesn't require sequencing of the tumor. And so we use the Guardant Reveal assay, which is a tissue agnostic MRD-like assay, and we ended up evaluating patients that had received neoadjuvant therapy across breast cancer subtypes. We found that roughly about 70% of patients, regardless of subtype, we could detect baseline circulating tumor DNA prior to neoadjuvant therapy. And importantly, if patients don't experience clearance of the ctDNA after neoadjuvant therapy, there's a higher risk of recurrence on the other side, which I think is something that we need to be thinking about when we're designing clinical trials for adaptive ctDNA-guided clinical trials in the adjuvant setting for patients that don't otherwise experience clearance after the initial standard of care therapy is